And welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui dans l'ordre suivant sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Blaine Higgs, Premier ministre du Nouveau-Brunswick. Speaking on behalf of the province today in the following order are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Bonjour à toutes et à tous. Good morning, everyone. Nous avons
8 weeks ago today, we began vaccinating New Brunswick's children against COVID-19. That was an important step in protecting 5 to 11-year-olds and all New Brunswickers against the virus. The next step is even more vital to provide these children with additional protection by giving them a second vaccine dose. It is crucial that we get vaccines into as many arms as possible over the next 10 days.
we began vaccinating New Brunswick's children against COVID-19. And that was an important step in protecting 5 to 11-year-olds and all New Brunswickers against this virus. The next step is even more vital to provide these children with additional protection by giving them a second vaccine dose. It is crucial that we get vaccines into as many arms as possible over the next 10 days. We need to have more children vaccinated, and we need to ensure those children who have received a first dose get a second dose as soon as possible. It is urgent that people who are 18 and older with 2 doses get a booster shot as soon as they are eligible, especially those who are more at risk of hospitalization, including those over the age of 50. We also strongly encourage all our school staff to take the opportunity to get their booster doses as soon as possible. And moving to level 3 of our COVID winter plan gives us that opportunity to make this happen. By staying within your one household bubble, limiting your contacts and following other public health guidance, you are giving the precious gift of time. Time to slow the spread of COVID-19 infections. Ce temps permet à notre système.
This time will allow our health system to manage the increase in cases and hospitalizations and will allow us to recruit people and volunteers who are indispensable to support the employees in our health system. This will allow us also to grow our vaccination rates, especially within our most vulnerable population.
Week, we have seen an increase in the number of New Brunswickers getting booster doses of the COVID-19 vaccine. More than 270,000 New Brunswickers have now received their booster. We need to keep this momentum going. Vaccines are safe and effective and are helping to limit the number of infected people requiring hospitalization. Au cours de la dernière semaine,
over the last week, more and more New Brunswickers have received a booster dose of the COVID-19 vaccine. We have to keep up the momentum. Vaccines are safe and effective, and they are helping to improve the situation.
Vaccinated and under-vaccinated who are experiencing the worst effects of this current wave. 2/3 of our ICU patients are either not vaccinated or have received only 1 dose or have not received the booster dose for which they are eligible. Booster rates are increasing. As of yesterday, 36.2% of New Brunswickers have received their booster shot. A week ago, that figure was 26.5%. I want to say thank you to all New Brunswickers who have rolled up their sleeves for a booster shot, as well as the nurses, the pharmacists, and other health professionals who are administering doses in regional health authorities, clinics, and pharmacies across the province. Le pourcentage de la
The percentage of the people receiving their booster dose continues to increase. To date, 36.2% of New Brunswickers have received the booster dose, and a week ago the rate was only 26.5%. I would like to thank all New Brunswickers who have rolled up their sleeves to receive a booster dose, as well as the nurses, pharmacists, and other healthcare professionals who are administering the vaccine in regional health authority clinics and pharmacies across the province.
Plenty of vaccines on hand and many available appointments. Please do not wait any longer. This is particularly important for New Brunswickers over the age of 50 who tend to be more vulnerable to the effects of COVID-19. Currently, just 59.8% of people over 50 and just 71.1% of those over the age of 60 have received a booster shot. I want to publicly acknowledge those who have come forward to help us get where we are today. To all New Brunswickers who were over 5 months from their second dose and who have rolled up their sleeves for their booster doses, thank you. You are now much better protected from hospitalization and severe illness. A sincere kudos to all the healthcare staff and providers and volunteers who have helped us bolster the vaccination campaign and open thousands of available appointments each day during this level 3 period. And of course, all of the frontline workers in the healthcare system right now who we know are pulling double shifts, etc. It is a very, very difficult time for healthcare workers all across this province, as well as for those in long-term care facilities and Ambulance New Brunswick and extramural. You have worked miracles for the people of New Brunswick. It is safe to mix your vaccine doses, and I urge you to not wait for a preferred brand. Moderna will be available to those who are 30 and over. Pfizer will only be available to those under the age of 30 for the next several months. Research shows that once you have received 2 vaccine doses plus a booster shot, the potential for severe illness and hospitalization due to COVID-19 is significantly reduced. We also need to see more of our children vaccinated against COVID-19.
Since becoming eligible to receive a COVID-19 vaccine on November 26th, thousands of school-aged children have been vaccinated. However, progress has slowed in recent weeks. Only half of eligible children, 53%, have received a first dose of the vaccine.
Since children became eligible for the COVID-19 vaccine on November 26th, 29,002 New Brunswick children aged 5 to 11 have been vaccinated. But progress has slowed in recent weeks. Barely half, 53.2% of eligible children have received their first dose. Vaccination provides an important level of protection for children, along with masks, maintaining physical distance, and other measures. The vaccine is safe. Health Canada's drug review process is recognized around the world for its high standards. Young children receive a reduced vaccine dose compared to adults, and the number of adverse events reported nationally is extremely low. By getting vaccinated, kids will be better positioned to stay healthy when in-class learning resumes. It will make it safer for children to play together on our playgrounds, sports fields, and hockey rinks. By getting your kids vaccinated, you will be helping them get back to being kids. Once your child reaches the 8-week mark following their first vaccination, they require a second shot. Appointments are now available for children who are at or near this mark. Make sure your child gets their second dose as soon as they are eligible. This will strengthen the protection that the initial vaccine provides. We are in the midst of a storm, and the storm is not over. We know our frontline healthcare workers are under tremendous pressure right now. And I ask the population to renew your demonstrations of appreciation and thanks for those who have worked tirelessly to care for those in our communities, hospital facilities, and our long-term care sector. I want to thank all New Brunswickers for their patience and vigilance as we work to limit the impact of this latest wave of the global pandemic. We can get through this by supporting each other, our families, and our communities. That means sticking to your one household bubble and limiting your contact with others as much as possible. That means watching for symptoms of COVID-19, getting tested, and staying home if you become ill. It means taking advantage of these 2 weeks to get vaccinated, young and old alike. These actions are making a difference.
You are helping to make things better. Let's stay strong and look after each other. Thank you very much.
Good morning. Bonjour. Last Saturday, New Brunswick moved to level 3 of our winter plan, following projections from public health on impacts the Omicron variant would have on our province. Le passage à la phase 3 est pour une période de 16.
The move to level 3 is for a 16-day period.
We have 9 days left until January 30th at 11:59 p.m. 450 healthcare workers are sick or isolating, resulting in pressure on the remaining staff, all the while having the highest number of hospitalizations connected to the virus that we have seen to date. Bien que ce soit un pas net, il semble que nous.
Even though there seems to be a net loss, it appears that we now have a balance between those returning from isolation and others, and as others go out. And that is positive.
In mind, I want to stress that we likely still have not seen the peak of our cases and hospitalizations. But our ability to manage the situation is improving thanks to the dedication of multiple teams. We have seen that we're starting to see people come back now after their 5-day isolation period or contact taste or getting beyond. So we're starting to see a rotation. We're still not out of the woods for sure, but it is a positive sign. We're seeing our hospitalizations, although they're still climbing or staying relatively flat. It is what we hoped would happen with the measures that were taken. We're seeing the vaccination, as Dr. Russell had just said, very impressed with the inclination that we've seen for people to get vaccinated and to meet our minimum targets in order to go back to level 3. But obviously, we need to, in order to keep moving forward as a society, we need to keep up this pace. Many, many volunteers have come forward in order to make this happen, and it is exciting to see us rallying once again. We've seen very high adherence to the rules, and although there are certain businesses that obviously got a frustration, have said, well, we just are staying open. Fortunately, they have now complied, to my knowledge, and we respect there's a need for everyone to follow the rules, because we too want to have this start to move back on the date that we've put forward. While we are continuing to closely monitor the situation, Public Health is reporting that, as I've just mentioned, early indications that the number of hospitalization, it is growing at a slower rate than expected. Early indications are showing that there's been a 30% reduction in people's contacts, which is exactly why we're in this situation with the level 3. But it's good news, and I'm hopeful that that trend will continue. Until then, these restrictions are allowing us to lessen the impact as much as possible by giving us the extra time to improve our booster dose levels, particularly for those who are at higher risk. Those who are over 50 years old with the underlying conditions of getting children aged 5 to 11 vaccinated, and provide as much support to our hospitals and healthcare centers as possible. And we're seeing this reality happening. Today, we are almost 60% of those aged 50 and older, and over 71% of those aged 65 and older who have received their booster, which also is very positive news.
We've said it many times, but the best thing to do to protect yourself and your family is to be fully vaccinated and to receive your third dose if you're eligible.
Value has been vaccinated is evident when looking at hospitalizations who most generally are impacted. Approximately 75% of our hospitalized cases are either unvaccinated or partially vaccinated. And while only 9.5% of the overall eligible New Brunswick population is unvaccinated, unvaccinated New Brunswickers make up more than 15% of hospital cases. I am so pleased to see so many New Brunswickers answer that call to volunteer and support clinical and non-clinical health operations, with more than 3,000 individuals submitting applications to assist. Thank you to all New Brunswickers. On travail.
Work is underway to place volunteers where they can serve best.
Of nurses with critical care experience, and I encourage anyone who is able to offer their assistance to please do so. Merci de vous être porté volontaire.
Thank you for stepping forward to support your community and your province.
It's really humbling to see people, friends, neighbors step forward to make a difference in the lives of their neighbors, of their family. and to be part of a solution as we continue to battle the pandemic. But we will battle and we will be successful, and the current trends show us to be on track to meet our target changes. As we have done throughout the pandemic, we're taking steps to find a balance that enables us to provide the services that the public expects while keeping our healthcare system from hitting a point where hard choices get made of who gets to live and who does not. Right now, Horizon and Vitality regional health authorities, along with Extramural and New Brunswick, are working together to make sure that critical life-saving services are available for New Brunswickers when they need them. Je les remercie.
I thank them for their sustained efforts and their determination to see to the health and safety of our province, and I know this is not easy.
Alleviate the pressure on the healthcare system. The Department of Social Development has been working with long-term care home operators to create a pool of emergency long-term care beds throughout the province. Under this initiative, 160 beds have been identified. Certaines personnes âgées.
Some seniors have already been discharged from hospitals, and it is expected that more will begin to be transferred as early as next week.
Who are waiting for a permanent nursing home placement to receive a 24-hour nursing care in a home-like environment, while at the same time freeing up hospital beds and creating more capacity in our health system to meet the needs of those who are seriously ill. Pendant ce temps, le ministère.
During this time, the Department of Social Development will be working with their partners to improve the program, the home support care program for seniors.
To avoid admission to the hospital and to be discharged and moved back to home whenever possible after admission. Nous travaillons ensemble.
We are working together to find innovative ways to face challenges in our health system, in which our health system must face.
Education and early childhood development and 7 early learning and childcare facilities have been identified to help meet the care needs of nurses with children working in impacted hospitals around the province. Notre retour prochain à la phase 2 va aussi permettre aux élèves de retourner à l'école partout dans la province.
And this will allow for phase 2 to come back and allow our students to return to school.
31st. And will be following the guidelines of the winter plan to minimize the risk to students and school staff. Minister Cardy will have more to say on the steps being taken to ensure this happens early next week, as well as on the use of HEPA filters in schools. To our business owners, I want to thank you for your resilience. I fully understand the impact of what is being asked of you. We are offering help through ONB and both through the NB Small Business Recovery Grant and also financial support for businesses with sole proprietors. We have 9 days left. We can do this. We've been working hard to ensure that information is presented in a way that is accessible and easy to understand. You will notice some changes when you visit the COVID-19 dashboard later today, as it is being enhanced to provide new information and make important data easier to find. Although we will continue to report case counts, rapid test results are self-reported. So the true impact of COVID in New Brunswick cannot accurately be measured in terms of cases. Instead, as we've said before, we are focused on hospitalizations and the impacts on our entire healthcare system. We have a new landing page that will include data on hospitalizations and ICU admissions, including an indicator of how the data has improved or worsened since the last report. Nous allons indiquer le nombre.
We will talk about the people admitted in hospital due to COVID-19 comparatively to those who were admitted for other reasons but were then declared COVID positive when they were admitted.
Also provide the percentage of hospitalizations, ICU patients requiring a ventilator, and deaths based on vaccination status since December 1st, just before the Omicron wave hit. Since we know that vaccine efficacy weakens over time, this data will be divided into 2 categories, those who are fully vaccinated and those who are not. Finally, we will add information on the new landing page to help show the status of our healthcare system including the number of employees who have tested positive and are isolating, as well as the overall hospital and ICU occupancy levels. I want to take this opportunity, as certainly I've done many times before, but as always to our frontline workers, our teachers, educational assistants, healthcare workers, and so many others who will be bringing our system back to normal, who will be there for our kids to return to school, who are there currently now, our nurses and healthcare workers and cleaners that are in hospitals that are looking after patients every day. And I know it must be really stressful because I read a recent tweet of a nurse working in a hospital, and then to hear criticisms about not getting vaccinated or getting vaccinated and why people shouldn't be vaccinated and all these things that we know do not comply with not only the recommendation of public health, but the recommendations from around the world. The best attack on the virus is being vaccinated. So hats off to those nurses and those workers that continue to forge on to do what is right by their province and by their families and by their friends and by their neighbors, in the face of some who don't appreciate. I just want each of you to know that I very much, deeply appreciate the work that you do every day and the work that will be done coming forward to get our lives back to a normal of some type, where once again we can see friends, we can have sports, we can be in school. Thank you from the bottom of my heart.
We appreciate everything you are doing and everything you will continue to do to keep our province moving forward in difficult circumstances. Thank you to all New Brunswickers for taking the steps needed to limit the impacts of Omicron and protecting all those around you.
When we announced this 2-week lockdown, the goal was to ease the building pressure on the healthcare system and to get our vulnerable citizens boosted. I'm thankful to all of our frontline workers and the civil service because in my morning meetings with Public Health today, I was told we are currently on target to go back to level 2 as anticipated. Now that could change, but right now, I'm just happy and excited to report that we are on track, and it's because everyone is being part of the solution. And I just, again, can't thank you enough. Évidemment, nous voulons.
Obviously, we want to eventually get back to level 1 and fully reopen. Now is not the time to give up.
The case counts will continue to rise, but we together have now given our healthcare system the chance to better manage this. Thank you. Merci.
Merci beaucoup, Monsieur Premier Ministre. Dr. Russell. Thank you, Premier. Thank you, Dr. Russell. We will now proceed with questions from members of the media. We have 21 reporters and only 1 hour time frame for today's briefing. I will try my very best to allow each reporter one question. I will be rotating by news organizations. You have the right to pose your question in the official language of your choice. Nous allons maintenant procéder aux questions des journalistes. Nous avons 21 journalistes et seulement 1 heure pour cette mise à jour. Je vais faire mon mieux possible pour mettre à chaque journaliste de poser une question aujourd'hui. Je vais faire rotation des organisations, des membres des médias, de presse. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Travis Fortnum, Global TV.
Hi there. My question is for Premier Higgs. Obviously, commenting on court cases is complicated, so I won't ask specifically about Dr. Angola's lawsuit alleging there was an abuse of power. But after he and some other doctors left Campbellton, immigration advocates fear the way things played out will hurt the province's efforts to recruit more doctors and more immigrants. Do you see where that concern comes from, and what are we doing to ease those fears?
Well, I would suggest that if all the facts come out in a proper hearing, and if it has to be a court challenge, and then that's I guess where it's headed, that will allay those fears.
Premier Jacques Poitras, CBC.
Good morning. The triggers to go back to level 2 are a decrease in the 7-day average of cases and hospitalizations. So will those remain the criteria? And if so, are the cases just PCR cases or PCR plus rapid? And are hospitalizations people hospitalized for COVID or people hospitalized who have COVID?
Want me to start? Okay, thank you, Jacques. So as you know, when we switched to our prioritization for PCR tests, we are capturing the POCT tests that are recorded by individuals. But again, that is left to individuals to do that. So it's only as accurate as how many people do that. So definitely right now, we are most concerned with the hospitalizations. And that's really what we're basing a lot of our analysis on right now. Based on everything that's happened this week and the trends that we're starting to see, it's very early. We'll have more information by next week about how well we're doing. But the fact that we do get the sense that people have really succeeded at reducing their contacts. We are having success recruiting volunteers to help with the resource issue in the healthcare system. So that's a positive thing, and we continue to encourage vaccination and boosters. So we seem to be on track at the moment with respect to where we want to be, and we will have more information next week.
Sorry, that didn't answer my question. Hospitalizations, are they people with COVID or hospitalized for COVID that will trigger level 2?
We're having discussions about dissecting that type of qualification. And basically, if you break it down simplistically, somebody who comes to the hospital having not been diagnosed with COVID doesn't mean they weren't already positive for COVID before they arrived. And in some cases, it's clear that the COVID is exacerbating whatever chronic underlying medical condition they have. The other thing about a person with COVID, whether they're diagnosed before or after admission, for whatever reason, COVID patients require much, much, much more resources in the hospital. So when you're treating a COVID patient, it's the equivalent of treating probably 2 or 3 regular non-COVID patients, in the sense that the donning and doffing of equipment, of PPE, the way that the patients need to be cohorted or isolated, et cetera. It's just it's a much higher burden with respect to human resources. So I'm not sure how that's going to play out, but for the time being, we are having those discussions. But again, with respect to the impact on human resources, whether you're admitted with COVID or for COVID, the impacts are very similar.
So, and if I was to add what Dr. Russell is saying, that certainly, we followed these measures in order to limit the number of total hospitalizations. And at this point, optimistically, it looks like, that is having that effect. So that's encouraging because we were staffing up for worse cases and trying to say, how do we manage this? Well, every day we're learning to manage a little bit better with what we currently are faced with. And we know that can all change overnight. A big factor in that is people being able to return to work. And so we're kind of at, as we've seen before, we get out this period of time where people are all out and then they start coming back, and we have less people going out that are coming back. So that's going to play a big role too in this. So it is going to get to be hospitalization still. I would say that is the biggest factor, as Dr. Russell says. And if you have COVID, you have COVID, and it requires so much more effort in the system. But relying on public health analysis of what does that look like, where we're going, and relying on the medical professionals that are running our hospital network as to how they can best manage, and the health workers that are actually doing the work, how they are faring through this and their situation, I think it all factors in to what the next step looks like and when it can be achieved. But it has been a learning process, but I just reiterate, as of today, we're optimistic that the case counts will stay manageable and we can stay on track.
Thank you both. Laura Brown, CTV.
Hi, Premier. There have been many businesses who've spoken out this week about how both level 2 and 3 have impacted their businesses and their staff. Hundreds have been laid off. They feel they've been doing everything they can to keep patrons safe, but are still being shut down. I'm wondering if there's any further consideration for more financial help, because if we do go to level 2 on January 31st, they will still be limited in how they operate for as long as level 2 goes on.
So that is correct. They would still be limited under level 2. I guess thinking about what further that can be done going forward, as we've contemplating and are doing so now, what other restrictions or impositions do we impose on those that choose not to be vaccinated and are negatively impacting our ability to manage our healthcare system? And I would say our ability to have businesses operate more freely. So each business can look at their own employee status and, say, are they vaccinated? Are they not vaccinated? And how do we manage people coming and going who are vaccinated versus unvaccinated? So I think there's probably a nuance there to look at going forward that as we analyze, what does long-term look like? So right now, our goal is to get back into level 2 as planned. And but over this next week, we're looking at all aspects, working with public health. We're looking at the rationale of what we're seeing right now, and working with businesses to understand how do we continue to put a program forward that people can see timelines in which we can steadily get our businesses fully open. And we just aren't able to put that in a timeline right now. But this 2-week break in a circuit breaker, as we can call it, or lockdown, has given us some renewed, I guess, encouragement about timelines.
Thank you. Savannah Odd, Telegraph Journal.
Hi there, can you hear me?
Yes, thank you.
I guess I'm just wondering, as we are going through, I guess, this absence of healthcare workers, we're seeing 450 today. I'm wondering what's being done to kind of fill those gaps, not only in acute care, but in long-term care as well. We've heard from the nursing union that nurses are being reallocated. So of course, nursing homes are now shorter staffed, but then we're also moving patients out of hospital to other beds in long-term care. So I guess, can you explain how that staffing gap is being managed at this moment? And will there be anything else being done?
I would say that, we're looking across the spectrum of who can qualify to move into these areas of need and do it expeditiously. And we're seeing that with the number of volunteers right now that in the process is a very focused group to say, where are you from? What are your credentials? And you've seen us put out this request for retired nurses or nurses of any certification. I say certification in the sense of, are we able to certify them here in our province? They obviously would have to have the health qualifications to do so, but can we do it in a timely manner? Meetings and agreements have been held with the unions in relation to moving people quickly. And that would require, being able to work with them on recertification or certification upgrades. I think that where we are right now is we're seeing hospitalizations that are impacting elective surgeries, impacting some elective visits that would normally be done. So we have a lot of people that just aren't there doing what they would normally be able to do, or patients being able to get done. So we're trying to bridge that, and the more people we can put in. So there's a very concentrated effort here with looking at people from all over the province and outside to staff areas that have highest priority. So when moving people out of the hospital, that frees up staff. In changing some of the things you've seen in hospitals has freed up some of the staff. Some hospitals that aren't able to continue doing the services they used to do has freed up staff. And it's all done with that in mind. People have been moved throughout the province from one facility to another to meet the demands of a particular facility. That will continue for this time period with the addition of as many people as we can get, as quickly as we can get them.
Oh, l'Acadie Nouvelle.
Hello. I have a question. I would like to hear the Premier and Dr. Russell about this. Mr. Higgs, you want to go back to phase 2 at the end of the month. First of all, is Cabinet in agreement with that? And for Dr. Russell, does public health support this decision, given what Mr. Higgs saying that we still don't have enough, the hospitalizations are not going down quite enough yet?
Certainly, the discussions that we've had to date were all based on this 2-week window. And what we've said throughout this press conference has been related to us meeting the current target. So is cabinet approval of this? Yes. As public health, is this their recommendations? Is that what we're following? Yes. Now, could something change between now and 9 days? Of course. But what we're saying here is that our current trends look good. From the very beginning, we talked about a 2-week time frame. So that's not a new date. It's not something that was invented on the fly. It was the discussion that was held, and when we all agreed on next steps, it was we need this 2-week window.
So,
So I would just like to add that, yes, these are the recommendations of public health, but as the Premier said, if things change between now and the end of next week, we will have to have many other discussions at that point.
Radio-Canada.
Alex Villeneuve, Radio-Canada. Hello, my question is for Madam Russell. When it comes to the people who are dying people who are suffering of the disease of unknown causes, why is it that one person has been taken off the list, but that we are still not offering any hypotheses for their diseases? Why is it that we are not investigating for when it comes to... Okay, just a minute, Mr. Villeneuve. Can you speak?
Tellement.
Louder, Mr. Villeneuve. We didn't hear the question. Yes, when it comes to the neurologic disease of unknown cause, why is it that some members have received a letter from the investigative committee saying that they were taken off the list of the suspect case, and at the same time, we are giving hypotheses without being able to properly diagnose their disease? Well, I don't have permission to discuss the individual cases, so the only thing we can say at this time is that during our investigation with the committee, that we promised all patients that we will contact their family doctor or them directly to give them information as to how the investigation is going. Thank you, Mr. Villeneuve.
TV.
Thanks, Bruce. We've been made aware that there are more than 30 long-term care facilities that have outbreaks, and there are hundreds of residents with COVID. I'm just wondering why public health is not actively reporting outbreaks, and how does the government respond to the union saying the government has failed the long-term care sector?
I'll just start with what public health has been doing and the Department of Health that has been doing with respect to protecting vulnerable populations throughout the pandemic, and that is making sure that they are the first priority with respect to vaccinations and boosters. So in terms of all the patients that are living in those facilities, they would have been the first in line for doses and boosters. With respect to protection, I don't really feel like at this point, other than the issues around healthcare workers and staff and human resource issues, which again, we're working very closely with social development and the RHAs to address these in a timely fashion, along with our call out to volunteers. So between, the protection that the vaccines and boosters have offered, as well as our ability to work with social development and the regional health authorities around human resources, we've always had the outbreaks led by social development with respect to those facilities. So, but with respect to our contribution from a public health perspective and a health perspective, we've been at the table the entire time with respect to recommendations and actions and operationalizing them.
Thank you. Hadil Ibrahim with CBC.
Thank you. Dr. Russell, Nova Scotia is recommending people who take rapid tests swab both their throat and nose. Can you tell us if this is something New Brunswick is recommending and describe the best way to do that?
So Nova Scotia is in a very different situation. Number one, the data that they're basing their recommendation on was something that they did, well, there's different studies out there, but one was actually done in Nova Scotia, and we had a presentation on that data yesterday at our national call with all the chief medical officers of health across the country. They did have very impressive results. However, the problem is that those tests were done under supervision. And so it doesn't really apply to our system in the sense that we give our point of care tests to people to bring home and do themselves without any supervision. So at this time, we won't be moving in that direction, but it was certainly really interesting to hear the outcome of the study that they had done in Nova Scotia and definitely the rationale for why they're moving in that direction.
Thank you. Ailish Bonang from CTV.
Hi, Bruce. Sorry, just 1 second here. So now that we're just about 2 years into the pandemic and there's been so much talk of, people feeling that COVID fatigue, do you feel, and this question can be for either, do you feel that enough people are getting their booster shot, or is that fatigue impacting the rollout?
It's hard to say what's impacting the rollout. I think there are some people who definitely had side effects with the first and second dose. The boosters are a smaller dose, so technically we wouldn't expect the same amount of, for the Moderna anyway, it's a smaller dose, so we wouldn't expect people to have the same side effects with the third dose. So it's probably a combination of also brand recognition. People were more focused on trying to get Pfizer doses as opposed to Moderna, but the supply of Moderna is much greater. So we don't have a choice right now in terms of who is eligible to get Pfizer versus Moderna. We have to reserve the Pfizer doses for the under 30 population. And that's a problem at the national level. At the federal level, we weren't, the federal supply was just not there. So I think between brand recognition and as you say, fatigue, also perhaps side effects that people experience, and perhaps not understanding that with this surge with Omicron, that the 2 doses just isn't enough protection to prevent serious illness and hospitalization. So perhaps people aren't necessarily hearing that message. And as cases are going up, many people have been waiting. People do sign up for their boosters. So there's a lag time from the time that you sign up till you actually get it. But we have the capacity in terms of the doses, and we have the human resources right now assigned and allotted for being able to increase our booster doses at this time.
John Chillibex, Telegraph Journal.
Hi, a message a question for Premier Higgs. There was a letter sent by Mike Babineau, who owns a lot of restaurants in Fredericton. I'm not sure if you've had time to read it, but he's quite upset at you and your government for the restrictions because the last 2 years, it's made it very difficult to do business, and he's not alone in that regard. And he's very concerned that once we do go to level 2, probably in a week or so, that with the 50% capacity limit, it'll still hurt their business because whenever these restrictions are in place, the restaurants are empty essentially. So his argument is that restaurants haven't been a big point of infection during this pandemic, at least not in New Brunswick. And why not let them have more room to operate along with other non-essential businesses? What do you have to say about that?
Well, I guess what I would say initially is that Omicron has presented a new area of transmission that is a problem for us, and so it's made it more difficult to have any gatherings that would see people routinely coming and going, and new people at that. I certainly understand the impact it's had on businesses. Throughout, we have tried to keep businesses open, and as that, we haven't locked down much throughout this whole pandemic. I would also, suggest, and because part of what we saw in the cases of people coming to restaurants, the vaccinated folks would say, I'm doing my part, I need to get back to normal. I assume that, that this situation is that all the workers are vaccinated in the operation of Mr. Babineau. It would be important that's part of his ability to identify that, because he has the right to ensure that. All of that gives us more capability to look at the next levels and when we can move on. And that's why I said earlier about, working with public health and my colleagues to determine a path forward. So all business owners could see, okay, here's where we are, here's what we need to achieve in order to get there. And I'd like to say that, we were very precise on our timelines here. Yes, the thing could go off the rails, but it is not looking like that at this stage. And we would want to do the same thing over the coming weeks and months to say, here are the timelines in order to get back up and running. And all of this has been about hospitalizations. So getting that under control first, and where it seems to be now stabilizing, if that continues, will allow us to put a projection forward, and with the confidence that public health can look at the numbers and say, yeah, that could work. But we'll follow the recommendations as we have, and I respect the impact it's having for sure on business.
Thank you. Simon Delatte, l'Acadie Nouvelle.
Simon Delattre, l'Acadie Nouvelle. Yes, a question for Dr. Russell. I'd like to know if you could explain to people what is the difference between patients who are hospitalized for COVID or who become COVID positive afterwards and eventually come under ventilators. What is the difference when it comes to the procedures within the hospitals? Well, that's something we are discussing regularly with the networks. And really, people who need to be treated for COVID in hospitals, usually there are many nurses, many professionals, especially trained for managing COVID cases, how to be properly, to have properly dressed, etc., and to follow the clinical pathways for these patients. Also, patients with COVID, this implies additional staff to train and assist and coach people who have to take care of this unit. They also need additional staff at an environment for disinfection and finding ways to curtail the spread, and how we have to manage medicine inventory and shortages. It's important as well to have additional people looking at health when it comes to sick staff and curtailing outbreaks, etc., testing, masking. It's important that staff caring for these people work specifically in COVID units, and they must not be shared with other units, even if people are admitted with COVID or not. If they are COVID positive, all this additional staff is needed. It's really heavy when it comes to the impacts on human resources. And I said in English a while ago that one person without COVID, it's not the same thing. You need more human resources with COVID. So someone with COVID, for whatever reason, they require much more staff.
Radio Canada.
Nicolas Steinbach, Radio Canada. Hello, he's there, but his microphone isn't working. Sarah, would you like to take over then? Yes, certainly. So you want my question now? Yes, please. All right. Well, New Brunswick at this time is the third province with the highest amount of deaths. How can we explain that? Will this change by the end of the lockdown? You want to know if the number of deaths will change after this lockdown? Yes, that is that at this time, New Brunswick is the third worst case when it comes to the number of deaths by 100,000 inhabitants. So, what will explain this, and are we going to find a way of bringing this down? When it comes to how we hope to see the number of deaths go down, it's hard to say. But usually during a pandemic, a certain percentage in each wave and each variant will be impacted when it comes to people, whether they're vaccinated or not, whether people have gotten their booster or not, or their second dose or not, and of course their age. As you know, the number of the population of New Brunswick is much older, and so for people that are 50 and older and who have chronic diseases, we know that all these things impact people who will be severely impacted. In fact, if they have to be hospitalized or may have a higher risk of death. Thank you.
With CHCO TV.
Thank you, Bruce. Dr. Russell, can you tell us a little bit about the 700 treatments of Pfizer's antiviral pill that New Brunswick will be receiving this weekend? Who will they be used on? Will we be receiving more at any time? And the pill has been described as a game changer. I'm just wondering if you agree with that description, and if so, why?
I wouldn't call it a game changer at this stage of the pandemic, only because, one, we have such a small supply. So yes, it's good to have extra tools in our toolbox, but this won't go a long way. What we do know is that it has side effects, it has contraindications, it has drug-drug interactions that all have to be assessed with respect to who can actually benefit from this drug. It is for people with, it's called Paxlovid, and it's for treatment of mild to moderate COVID-19 symptoms. And obviously, the point of the outpatient treatment with this drug is to prevent hospitalizations. So with 700 courses of treatment, does that mean we can prevent 700 people from being admitted to hospital? Possibly. But again, we will have to see how this wave goes. We definitely will be looking forward to having a higher number of doses in the future. And again, not all people will need this medication, nor will everyone be able to benefit from this medication. So it doesn't replace the most protection that we can offer right now, which is vaccination. So that is the first and foremost thing that people need to understand, is that the most important type of protection that we can offer right now is vaccination, booster doses. So and again, that limited supply is going to mean that we have to manage it extremely carefully through prescribers with the regional health authorities. And at this time, again, we're not ready to distribute it, but we're working with our stakeholders to be able to have it available to patients as soon as possible.
David Coach, CHMA.
Hi there. Questions for Dr. Jennifer Russell. Some experts are saying surgical and cloth masks are no longer sufficient for preventing the spread of the Omicron variant. Will you be updating the provincial recommendations on types of masks, which I believe currently classify three-ply cloth masks as good and surgical masks alongside N95s as best?
Well, we've had many discussions about masks over the course of the last several weeks since Public Health Agency of Canada has changed some of their recommendations, which we are completely aligned with. So What's most important, yes, is that there's 3 layers, but what's also very important is the fit. So whatever kind of mask that you are able to wear in terms of the fit, it's very, very important. And certainly, depending on what type of situation, if you're out in the community, whether you're in a high-risk medical situation, again, there's different criteria within the hospital system around N95s that are the fit-tested N95s, because there's a difference between fit-tested N95 and a non-fit tested N95, the K95, et cetera. So there are vast differences between those masks in terms of their recommended use, but we are definitely aligned with Public Health Agency of Canada around the recommendation that the best fitted mask is the one that is the most important in terms of protecting people, and whether it's a three-layer mask versus KN95, we're in line with Public Health Agency of Canada.
Thank you. Bobby Jean McKinnon with CBC.
Yes, hello, can you hear me?
Yes, thank you.
Yes, do you have new modeling to show what we can expect if level 3 ends on January 30th as scheduled?
Hi, Bobby Jean. So we meet with our epidemiology team pretty much every day and our medical officers every single day. And so we definitely are monitoring the situation right now. It's too early to tell in terms of we need a few more data points on those curves to be able to really see what's happening. And any of those projections are again, it's a day by day issue right now. And then once we get further along, we'll have those data points to be able to see those projections and compare them to the projections we presented last week.
Tim Jakes with the Campbellton Tribune.
Yes, thank you, Bruce. My question's for the Premier. Mr. Premier, the events were a while back in the pandemic now, but in hindsight, is there anything you would say you wish had been done differently in the Dr. Ngola matter? And what do you say to Dr. Ngola at this point?
Well, I think previously I offered to, put all the facts as I knew them on the table, and they could be challenged or discussed in a very open manner, and that was declined. So now I'm just saying I would like for all the facts to come forward and be understood, because I think that maybe is the only way that it puts an appropriate end to this discussion. So I'm looking forward to all the details coming forward exactly as they unfolded.
Thank you. Nicolas Steinbach avec Radio.
Nicolas Steinbach, Radio-Canada. Hello, do you hear me now? Yes, please speak louder, please. Yes, hello. So, last week you said that you were going to take 2 weeks just to think about more strict measures for the people who are unvaccinated. And I wonder if now you have found some more stricter measures for the non-vaccinated. What would these measures be, and when do you believe they will be put into effect? I would like to hear the Premier on this, and perhaps have the reaction from Dr. Russell after that.
We are evaluating right now certainly what's being done across the country and what more we can do in terms of ensuring people are vaccinated who are moving around throughout the province and having interaction, particularly with others. There's various provinces that have had different requirements for vaccination registrations in order to participate. I mentioned here this morning about business owners ensuring their employees are vaccinated, and certainly that applies to any business who wants to keep a continuity of business and not have a lot of people out sick. They should all be interested in doing that. That can be from restaurants, accommodation, whatever business or private businesses of any kind. So we are evaluating that. It will come to a review with Cabinet next week, and it will be something that we'll discuss with Public Health and how effective the changes might be. But it is still on track to have that discussion next week, and then to present it, either any changes we'd be making, present them either at the end of next week or the following week.
Don't have anything to add.
Okay. Ross Lord with Global TV. Harry Forrestal, CBC.
Thank you, Bruce. This is for Dr. Russell. Dr. Russell, I heard mention of the number of 3,000 regarding volunteers that have put their hands up to help out so far. How are they being skilled triaged, I guess? How long will that take? How many have been cleared to help so far? And what more do you expect to achieve from that end of things?
So I believe in the online form that they fill out, that captures some information. There's two different streams right now. There was a call out for critical care nurses, and I believe 26 of those have been deployed already. And from the other volunteers that came in, what I know is that about 27 offer letters went out to nursing students this week. We're very happy about that, to have them signed up. But I don't have any more updated information other than there's a process in place to vet all of the volunteers, not just with respect to skill sets in terms of whether they're going to be able to do non-clinical work or clinical work, but also with respect to the time they're able to volunteer. So obviously it's more important to have somebody who has a lot of time to volunteer, because the investment in training somebody or orienting somebody, et cetera, does take time. So it has to be worthwhile in terms of again, how much time people have. So the applications are being prioritized at the moment based on all of those criteria.
Nathan DeLong, Miramichi Leader.
Good afternoon. Can you hear me okay?
Yes.
Okay, thank you, Bruce. My question is for Premier Higgs. Mr. Premier, I understand you announced the date a short time ago for the by-elections in the two vacant Miramichi area ridings. Because you frequently said throughout the last several months that concerns about COVID were why this decision was delayed, and your news release from your office says that it was made with health and safety at top of mind today, I'm wondering who you spoke to about when the timing would be best and if the date could change based on the COVID situation.
Well, certainly, the normal practice is to work with the elections New Brunswick in relation to looking at timing, and their concern too is, can they conduct an effective election, in this day and age with COVID as part of the experience, but also in where we hope to be in working with public health, but where we hope to be by that period of time. So, looking at the election being announced now and the dates being set now, so everyone can prepare for that. And by the June, we should be in a better condition publicly in public health concerns. But I won't suggest that it couldn't change, but I'd like to think it's very unlikely, and it certainly would only be changed if it was a directive from public health that it was not safe to do so.
Thank you, Premier.
Thank you.
Dernière question.
Last question, Mathieu Papillon, Radio-Canada. Hello. That the thing about bringing people back to phase 2 on January 31st, is that a response to a less than committed people to COVID measures?
The purpose of when we started this, to put a date on it, was to give people hope that, we could give the break in the hospitals, because it was being a plea from our medical professionals in the field, both on the floor and certainly in any aspect of managing healthcare, that they were overwhelmed. And we know there's been challenges prior to COVID in terms of, the issues affecting the healthcare system. But we've seen across the country the vulnerability of our healthcare system. So in doing that and putting a timeline on it, it was a request from public health and those health officials that we need to have this breathing room and minimize the admissions coming into hospital. But we feel the 2-week break will give us that sufficient time. So it was unique in the sense it was kind of the first time that we'd actually defined a start and stop date. And yes, it had criteria that have to be met, and that criteria still has to be met. But the indications are right now is that people are indeed doing their part to meet the criteria, and with a few minor exceptions. So we remain optimistic that we'll be able to stay on track. And I think people need to really know that is a nuanced difference from past, and that, as we get into level 2 and looking beyond through the summer, there will be continued discussions about timelines in which we can make improvements, but it'll all be based on the science of where are we at the point in time and what are the projections going forward, and can we manage our healthcare system.
Thank you. Merci beaucoup. Thank you, everybody. Voilà la fin de notre mise à jour. That concludes today's update. Thank you.